Hello everyone. Today we're going to talk about genetic testing and periodontal disease. Predictive medicine is a field of medicine that predicts the probability of disease and institutes preventive measures in order to prevent or significantly decrease disease and its impact upon the patient. Predictive medicine predicts diseases and avoid, delay, and diminish symptoms or diseases. Every method to predict future diseases is based on genetics, DNA, and genomics. Now we can know our background to change our habits in order to prevent diseases. The progression of knowing, changing, and preventing is the base of predicting medicine. What is a genetic disease? Genetic disease or disorder is the result of changes or mutations in an individual's DNA. A mutation is a change in the letters DNA sequence that make up a gene. Genetic diseases can be monogenic or multifactorial. Monogenic, a single gene mutation is involved, and this single gene has to be present for the disease to show. Multifactorial diseases they are polygenic because many genes are involved, plus the environmental factors. Both have to be present for the disease to show. Multifactorial heredity is like a playing Russian roulette. The black numbers are the genetic factors and the red numbers are the environmental factors. The more gene gets, the more chances to get the disease. The multifactorial heredity, we need to have the affected genes plus the environmental factors for the disease to be present. Among the multifactorial genetic diseases, we can find cardiovascular diseases, osteoporosis, diabetes mellitus type 2, obesity, and of course, periodontal disease. The causes of periodontitis are genetic risks, hereditary factors can affect the patient's inflammation and immune response. And we all know that periodontitis is an infectious disease with the bacteria pathogens known as periodontal pathogenic bacteria. The genetic component plays a key role in the onset of periodontal disease. In fact, the genetic component can modulate the inflammation of the mucous membranes and the loss of alveolar bone. The role of genetic susceptibility could impact on the clinical manifestations of periodontal disease and consequently on prevention and therapy of this disease. The genetic component of periodontitis, interleukin-6, is a signaling protein produced by its defense cell in its response to stimuli such as infection and trauma. Interleukin-6 has important effects in the response to microbial insults, acting as anti-inflammatory and also a pro-inflammatory agent. In chronic inflammatory processes, interleukin-6 may affect the susceptibility, development, and progression of a number of autoimmune and inflammatory diseases, such as atherosclerosis, rheumatoid arthritis, and malignancies. Most of these local inflammatory factors are controlled by the interleukin-1 gene, making it a key regulator in the inflammatory process and a prime candidate for a genetic association with periodontal disease. The presence of the interleukin-1 genotype does not confer an expected periodontal disease diagnosis by itself. However, the gene has been implicated as a contributory factor in determining the severity of adult periodontitis. The bacterial component of periodontitis, we know that bacteria destroy endogenous tissue and cause inflammatory responses and causes resorption of bone loss and loss of teeth. Early testing of pathogenic bacteria is advantageous before placing dental implants. 5 obligatory anaerobic species are the bacteria that produce periodontal disease. Genetic testing is a type of medical test that identifies changes in chromosomes, genes, or proteins. The results can confirm a suspected genetic condition or help determine a person's chance of developing or passing on a genetic disorder. There are two kinds of genetic tests for periodontal disease. One is myperiopath. This is specific for pathogenic bacteria. The criteria for this test is adult patients, aggressive periodontitis resistant to current therapy, family history. Objectives for this test are effective pharmacological treatment, prevention of periodontitis, and family studies. Pathogen analysis enables choosing the most appropriate medication and help avoiding inefficient therapy or even treatment failures. The other test is a genetic susceptibility for periodontal disease. This test will determine increased risk for severe periodontal infections in some individuals. The criteria for this test is adult patients, aggressive periodontitis resistant to current therapy, family history of periodontitis, particularly with interleukin-1 risk genotype. Objectives for this test: personalized treatment, prevention of periodontitis, and family studies. The genetic testing is done by the client rinse out with this saline solution that has a preservative on it. After the rinsing, the client spits out on this tube the sample. The tube is closed and labeled and sent it to the lab. Testing of saliva can help the clinician provide an earlier and more specific diagnosis of disease based on causation. Treatment planning is also enhanced as therapy can be appropriately modified based on both clinical and biological inflammatory factors. Finally, patient communication and case acceptance can be more readily achieved because the test reports elicit a persuasive seeing is believing attitude when reviewing test results with patients. For this technology, now we are able to know the answer for this question. Does your DNA determine your risk of dental issues? Thank you for your attention. This is a link if someone wants to read more about this genetic testing. This is the link for an interesting article and my references. Thank you so much. Have a great day.